Hello everyone, welcome to Audiobooks. Today, we're going to dive into an important topic that is often overlooked: fertility optimization. And, let me tell you, this is not your grandma's fertility talk. We're talking about the real deal, the nitty-gritty, the hot and heavy, the nuts and bolts of fertility optimization. So, pour yourself a glass of wine, sit back, and get ready for the most entertaining and informative fertility lecture you'll ever attend. Our guide for this journey is the one and only Andrew Huberman, joined by a special guest, the brilliant and beautiful Sarah Gottfried. Sarah is a gynecologist and clinical assistant professor of integrative medicine and nutritional sciences at Thomas Jefferson University. In this episode, we'll be summarizing the podcast, How to Optimize Fertility in Males and Females. You'll learn everything you need to know about fertility optimization, from the basics to the more advanced topics. So, what are you waiting for? Hit that subscribe button and join us on this journey to discover the secrets of fertility optimization. Without further ado, let's start with the serious business. Introduction. The podcast is focused on discussing science and science-based tools related to fertility, encompassing both male and female fertility. The aim is to provide an understanding of the biology and practical tools to improve fertility, vitality, and longevity. Topics include the menstrual cycle, spermatogenesis, embryogenesis, and various practices such as behavioral, nutrition-based, supplementation-based, and prescription drugs. The discussion distinguishes between germline cells, egg and sperm, and somatic cells, the majority of cells in the body. Germline cells are unique, protected cells generated in a specific way with genes that cannot be altered by individual experiences, while somatic cells can be altered by behaviors and experiences. The eggs of a female contain all of her DNA chromosomes and are diploid, 23 pairs of chromosomes, generated during embryogenesis, while sperm in males also contain 23 pairs of chromosomes. It's important to note that germline cells cannot be altered by experiences, and both the egg and sperm contain 23 pairs of chromosomes. Chapter 1: Female Reproductive Pathway. In human reproduction, there is a process of fertilization where the sperm cell and the egg cell, from the mother, must come together physically to form a single cell with 46 chromosomes, half of which come from the father and half from the mother. This leads to the creation of multiple cells which become the developing embryo. The onset of puberty in females allows the ovulatory and menstrual cycle to commence, leading to the maturation of eggs. The onset of puberty is controlled by signals from the brain and the body, with the process of the ovulatory menstrual cycle initiated by the brain. The hypothalamus in the brain communicates with the pituitary gland to control the release of hormones and neurotransmitters. The onset of puberty in females has been occurring earlier with each passing decade over the last 100 years. This trend has been observed in several countries like the United States, Norway, UK, Germany, and Finland. The average age of menarche, onset of puberty, in these countries has decreased significantly over the years. However, the cause of this trend is not clear, and there are several theories such as improved nutrition, body fat stores due to overeating, and psychosocial interactions. It is important to be cautious in drawing conclusions about the cause of this trend. The anterior pituitary gland releases two hormones, LH, luteinizing hormone, and FSH, follicle-stimulating hormone, into the bloodstream. These hormones travel throughout the body and can enter cells, changing the genes that are turned on and off and the properties of the cells. Different hormones have different effects on different cells, depending on the cells themselves. LH and FSH have a specific set of consequences when they arrive at the ovaries in a female. The same processes occur from puberty until menopause, when the ovarian reserve of immature eggs is depleted. The menstrual cycle and the lunar cycle are not causally linked. The menstrual cycle is a complex process in the female reproductive system and is controlled by hormones like FSH and LH. The first half of the menstrual cycle, the follicular phase, is when FSH triggers the maturation of a subset of follicles in the ovary, which contain immature eggs. The selected follicle and the mature egg then produce hormones to further the process. The menstrual cycle is an elegant interplay of hormones and genes. The menstrual, ovulatory cycle in females is a regulated process involving the release of hormones from the hypothalamus, pituitary and ovary. Gonadotropin-releasing hormone from the hypothalamus triggers the release of follicle-stimulating hormone, FSH, and luteinizing hormone, LH, from the pituitary. This causes a subset of immature follicles with immature eggs to start maturing and growing, producing more estrogen. As estrogen levels in the bloodstream increase, it triggers a positive feedback loop at the pituitary, causing the release of more FSH and LH, resulting in ovulation, where one mature egg is released from the ovary into the fallopian tube. The menstrual cycle is divided into two phases. The follicular phase, first half, marked by the presence of FSH and estrogen, and the luteal phase, second half, marked by the formation of the corpus luteum, which starts producing progesterone. The menstrual cycle is a complex process regulated by the hypothalamus, pituitary gland, and ovaries. The hypothalamus releases GnRH, which stimulates the pituitary gland to secrete FSH and LH. These hormones travel to the ovary and activate one egg out of the many that are stored in a vault. The selected egg ovulates, and the follicle that released it becomes the corpus luteum, which produces progesterone and sets in motion the luteal phase. If the egg is fertilized, it implants in the endometrial lining that was prepared by the progesterone. If the egg is not fertilized, the uterine lining sheds, and this is referred to as a period. The hormone inhibin is also produced by the corpus luteum, and it helps to prevent further maturation of eggs by inhibiting the secretion of FSH and LH. If fertilization doesn't occur and menstruation happens, inhibin levels drop and the pituitary gland is signaled to release more FSH and LH, starting a new ovulatory cycle. The duration of menstruation can vary from 1 to 5 days and depends on the amount of progesterone secreted. Chapter 2: Male Reproductive Pathway. Sperm are germline cells like eggs. They contain 23 chromosomes consisting of 22 autosomes and 1 sex chromosome, X or Y. They are produced by the division of other cells through a process called meiosis. The job of sperm is to deliver the father's genetic material to the egg in the form of a haploid cell. Lifestyle factors, such as nutrition and prescription drugs, can affect sperm quality. The sperm that fertilizes the egg will determine the sex of the offspring. The process of spermatogenesis is the production of sperm in the testes and involves hormones such as GnRH, FSH, and LH. The testes need to be kept at a temperature that is 2 degrees cooler than the rest of the body for healthy spermatogenesis. The sperm takes 60 days to mature, after which it migrates from the testicles to the epididymis, vas deferens, and finally into the urethra, where it can be part of the ejaculate. If you're trying to conceive, it is important to avoid exposing your scrotum to elevated temperatures by avoiding hot tubs, hot baths, and hot showers for at least 90 days. The testicle has a muscle called the cremaster muscle which responds to local temperature changes and helps to regulate the temperature of the testicles. This is important for sperm development and quality. Spermatogonia cells in the testicles differentiate into spermatocytes and undergo meiosis, reducing the chromosome number to 23 individual strands. The function of meiosis in sperm cells is dependent on the spindle and mitochondrial function. The spindle and the mitochondria help to separate the chromosomes in sperm cells. The spermatocytes and sperm cells do not migrate long distances within the testicles, but they still move around. Taking a cross-section of the testicle would show the different cells and structures within it. A vasectomy is a surgical procedure that blocks the vas deferens, the tubes that carry sperm from the testicles to the urethra. The seminal fluid is a mixture of fluids and sperm, while the sperm are haploid cells with 23 pairs of single-stranded chromosomes and either an X or a Y sex chromosome. Sperm have a head that contains enzymes and proteins to fertilize the egg, a mid-region full of mitochondria to generate cell motility, and a tail to swim towards the egg. The distance from the cervix to the egg is far, and the fastest sperm can swim the distance in a few days. The frequency of intercourse can affect the probability of fertilization, as frequent ejaculation can lower sperm concentration. The Leydig cells in the testes produce testosterone, which has many effects on different tissues in the body. The concentration of testosterone within the testes is at least 100 times higher than elsewhere in the body due to the presence of binding proteins and enzymes that sequester it. Testosterone and androgen binding protein from the Sertoli cells are necessary for spermatogenesis. Disrupting any of the chemical players involved in spermatogenesis, such as testosterone or follicle-stimulating hormone, would result in a marked disruption or elimination of sperm. The exact same set of players, from the hypothalamus to the pituitary, to the gonad, testicle, to the Leydig cells, to the Sertoli cells, to the spermatocytes, are necessary to produce healthy sperm. Chapter 3: Fertility Assessments. In general, fertilization occurs when a sperm cell fertilizes an egg cell. This usually occurs in the female reproductive tract, where the sperm swim towards the egg. Ideally, the fertilized egg implants into the endometrial lining of the uterus and develops there. The location and success of fertilization can be influenced by several factors, including the proximity of the egg to the implantation zone, the number of sperm cells present, and the sperm and ejaculate parameters. It is generally considered that a sperm count of 15 million sperm per milliliter of ejaculate is considered healthy. Ejaculate volume is usually between 1.5 to 5 milliliters and is determined by various factors, including frequency of ejaculation. The optimal frequency of intercourse during ovulation for the goal of fertilization depends on the quality and concentration of sperm in each ejaculate. Generally, it is recommended to abstain from intercourse 2 to 3 days before ovulation and to have intercourse once or twice the day prior and then a maximal number of times on the day of ovulation. Some experts suggest having intercourse as much as possible on the day prior to ovulation but not so frequently that it decreases the concentration of sperm, while others suggest having a maximal number of ejaculations on the day of ovulation. The best approach may vary depending on the individual's specific situation, and it is best to consult a healthcare professional for personalized advice. The timing of intercourse is important in maximizing the chances of fertilization and pregnancy. The best time is around ovulation, with the female reproductive pathway providing an optimal environment for sperm. The use of certain lubricants during intercourse should be discussed with an ob-gyn, as some can be detrimental to sperm health. The length of time a couple should try to conceive varies and is dependent on the age of the mother, as egg quality decreases with age. The chances of successful fertilization also depend on other factors such as sperm quality, genetic variables, and environmental variables. The probability of pregnancy in a given month depends on several factors such as age, health, and lifestyle. For women under 30, the probability of getting pregnant in a given month is 20%. This means that if a woman has not gotten pregnant after 5 to 6 months of trying, she should see a doctor. The probability of pregnancy decreases as a woman ages, and for women between 31 to 33, the probability is 18% and 11% for women between 34 to 37. The likelihood of pregnancy depends on multiple factors and is described as a cumulative pregnancy rate, which is the accumulation of the probability of pregnancy over time. OB/GYNs usually recommend trying to conceive for 5 to 7 months before seeking medical help. The probability of a successful pregnancy decreases as a woman ages, especially after age 40. This is due to factors such as chromosomal abnormalities and declining egg quality. The ovarian reserve, which is the number of follicles in the ovaries, decreases as a woman ages and is directly related to the size of the population of follicles released each month, which determines a woman's level of fertility. To determine their basic level of fertility, women can assess the size of their ovarian reserve. AMH, anti-Mullerian hormone, levels and antral follicle count are two ways to measure the population of follicles and eggs that leave the ovarian reserve each month. Women should measure their AMH levels or follicle count multiple times to determine the average number of follicles and AMH levels in their ovarian reserve. It is important to measure these levels earlier and more frequently to increase the probability of successful fertilization and pregnancy. Men should also evaluate the quality and number of their sperm through a sperm analysis, which is relatively inexpensive. Sperm analysis will give men a window into the number and quality of their sperm. It is recommended that men evaluate their sperm quality, especially if they are in their late teens, early 20s or 30s. In summary, it's important to have both male and female fertility assessments, including sperm analysis and egg reserve analysis, with hormonal analysis. This should be done regularly, especially as people approach their childbearing years, as 1 in 5 couples face fertility issues due to sperm quality or quantity. This information provides a reference point to monitor changes in reproductive health and hormone levels, and is also important to identify potential fertility issues early on. Chapter 4: Effects of Smoking, Drinking, Smartphones and Hot Tubs on Fertility. Smoking and drinking both have negative effects on fertility and pregnancy. Cannabis and nicotine have been shown to negatively impact the quality of the egg and sperm and increase the likelihood of birth defects and abnormalities. It is recommended to quit smoking, including cannabis and vaping, and to avoid alcohol altogether while trying to conceive or during pregnancy. The recommended limit for drinking while not trying to conceive is 2 drinks per week total. While pregnant or breastfeeding, it is recommended to avoid alcohol entirely. Excessive alcohol consumption, stress, and nicotine and cannabis use can have a negative impact on fertility and pregnancy. It is recommended to limit alcohol consumption to 1 or 2 drinks per week, manage stress through sleep and stress-reducing techniques, and avoid nicotine and cannabis use during the time of trying to conceive and during pregnancy. The data on the benefits of red wine and resveratrol are questionable. To maximize male fertility, it's important to keep the testicles cool, avoid hot tubs and saunas, keep laptops and other hot devices off the lap, and limit the amount of time spent sitting. Carrying 1 copy of the cystic fibrosis gene can lead to defects in the vas deferens and low sperm count, but can be repaired surgically or by extracting sperm directly from the testicle. Women should also be aware of factors that impact their egg quality and fertility when trying to conceive. The discussion is about the potential adverse effects of smartphones on sperm quality and testosterone levels. Studies have shown that smartphones emit radio frequency electromagnetic waves, RFEMWs, that can be absorbed by the human body and have negative effects on the reproductive system. The data suggests that carrying a smartphone in a front pocket can reduce sperm count and quality, as well as possibly affect testosterone levels. It is suggested to avoid carrying a smartphone in the front pocket and to keep it away from the testicles to maintain healthy sperm quality and fertility. However, the relationship between smartphone usage and fertility is still not clear. Exposure to cell phones and their radio frequency waves and heat can negatively impact sperm quality and testosterone production. This is because it can disrupt the Leydig cells of the testicles, which are responsible for producing testosterone, a hormone important for sperm production. However, there is controversy surrounding the topic and more research is needed to understand the biological variables involved. To mitigate the impact, experts suggest keeping the phone away from the groin area, avoiding carrying it in pockets, and using deliberate cold exposure like ice packs or cold showers. Cold exposure is believed to be healthy for sperm as it reduces heat, which is harmful to biological tissues, and reduces varicoceles, which are varicose veins in the testicles leading to increased temperature and reduced sperm quality. Chapter 5: Benefits of cold water exposure on fertility. Cold water exposure, or taking cold showers or immersion in water up to the neck, can have positive effects on hormones for both men and women. For men, cold water exposure can increase testosterone and improve sperm quality. For women, it can regulate cortisol levels and improve hormone production, as long as it is done safely and not too close to bedtime. However, these effects are indirect and not necessary if stress levels, sleep and other factors are being taken care of. Other factors that can maximize fertility for both men and women include getting enough sleep, avoiding alcohol, nicotine, and cannabis, avoiding excessive heat for the testicles and avoiding harmful chemicals. Chapter 6: Intermittent fasting and testosterone replacement therapy. Intermittent fasting does not typically disrupt fertility or likelihood of pregnancy in women with regular menstrual cycles. However, during pregnancy, it's recommended to speak to a doctor before starting any form of fasting. Cessation of menstruation can occur due to excessive caloric restriction or a caloric deficit brought on by excessive physical activity. There is limited data on the effects of intermittent fasting on spermatogenesis and testosterone production in men. However, for men who are excessively overweight, losing body fat is important for maximizing testosterone, sperm health, and spermatogenesis. For lean men, increasing calorie intake can increase testosterone levels. Testosterone replacement therapy, TRT, involves taking exogenous testosterone, which leads to a reduction in spermatogenesis and thus reduced sperm count. Taking testosterone from external sources can also stop the pituitary from producing luteinizing hormone and follicle-stimulating hormone. However, there are methods such as HCG or clomiphene to offset these effects, but these should be discussed with a urologist. Supplements that support hormones are not known to disrupt ovulation or spermatogenesis, but some supplements contain testosterone and their effects on reducing endogenous testosterone production is not clear. It's important to be aware of what is in the supplements and to listen to the episode about developing a rational guide to supplementation. Chapter 7: Sex Determination and Fertility. Sex determination is determined by the chromosomes from the sperm and egg that fertilize, resulting in XX, female, or XY, male, chromosomes. There is a lot of misinformation and unproven theories about what factors determine the sex of the offspring, such as sexual positions or thoughts during intercourse, but there is no scientific evidence to support these claims. In vitro fertilization, IVF, has advanced to the point where sperm can be selected based on factors such as morphology and motility, but there is no way to choose the sperm with XX or XY chromosomes. The sex of the offspring is determined by chance, not by external factors. Chapter 8: Body Position, Acupuncture, Supplements and the Possible Impact. There is conflicting evidence on the influence of body position after intercourse on the probability of pregnancy. Some experts believe that there is no need for a woman to change her position after ejaculation, while others believe that tilting the pelvis back and keeping the ankles elevated for about 15 minutes could improve the chances of successful fertilization. It's also worth noting that body position at the time of ejaculation does not influence the biological sex of the offspring. People are pursuing new ways of understanding why a particular sperm fertilizes an egg, but the reason is still not fully understood. Some people believe in various myths and legends surrounding fertility, but their validity is questionable. The position of the woman after sexual intercourse and ejaculation can influence the likelihood of fertilization. One argument is that tilting the pelvis and lying still for about 15 minutes may bias the likelihood of fertilization. This is because the quality of sperm, including the number of forward motile and high-quality sperm, is important in fertilization. The use of cannabis, however, can reduce the number of quality forward motile sperm and should be avoided in the 2 months prior to attempting to get pregnant. The effects of cannabis use by the woman on fertilization are not well understood. Acupuncture has been found to be an effective treatment for improving fertility and pregnancy outcomes. There have been clinical trials funded by government agencies, like the National Institutes of Health, which support the effectiveness of acupuncture. Chu-Fu Fu from Harvard Medical School has conducted studies which suggest that stimulation of different acupuncture sites on the body can impact various organs through neural pathways. This is helping to shed light on the underlying mechanisms of acupuncture and how it can benefit various health conditions, including fertility and pregnancy. L-carnitine is a supplement that has been shown to improve egg and sperm quality by increasing the mitochondrial function, which is important in the processing of lipids, the organization and action of the spindle that separates the chromosomes, and the fusion of the egg. The recommended dose is 1 to 3 grams per day, which can be taken in capsule form with or without food. The effects of L-carnitine can be seen after 30 to 60 days of daily use. The mechanism of action is through the processing of fats and lipids in terms of mitochondrial function, which is important in the formation of proper chromosomal arrangements and the forward motility of sperm. L-carnitine and garlic extract are suggested for improving egg and sperm quality. Coenzyme Q10, in the range of 100 to 400 mg per day, is also commonly recommended for improving fertility. Inositol, in the form of myo-inositol, is also often recommended for improving fertility by improving insulin sensitivity. However, it is important to consult with a doctor before starting any new supplement regimen. Omega-3 fatty acids, which can be found in fatty ocean fish, krill and plant-based sources, can help optimize egg and sperm quality. It is suggested by some healthcare professionals to take omega-3 fatty acids in supplement form, with a minimum of 1 gram per day of the EPA form and as high as 3 grams per day. Tongkat Ali, taken at 400 mg per day, can increase free testosterone, luteinizing hormone, and libido in males and females. Tongkat Ali does not need to be cycled and can be taken with or without food. It is important to always consult with a trusted healthcare professional before adding or changing anything in your overall health regimen. Zinc is important for both males and females to maintain health, but it may have additional benefits for male fertility. High levels of zinc can be obtained through food, such as oysters. However, additional supplementation of zinc may also be beneficial for sperm health and testosterone production. It is important to consult with a physician before taking any supplement, including zinc. To summarize, taking zinc supplementation, 120 mg 2 times a day with meals, can impact testosterone levels and sperm quality in males. There have not been systematic studies on the effects of high levels of zinc on females. For both males and females, prescription drugs can also be used to improve fertility under the supervision of a doctor. Some of these drugs include HCG, FSH, clomiphene, testosterone, and anti-androgens, among others. These drugs are prescribed based on the specific hormonal imbalance and are administered under the guidance of an OB/GYN or a fertility specialist. The complex interplay between hormones, the brain, the pituitary, and the gonads is tightly regulated and provides doctors with the tools to diagnose and treat fertility problems. Epilogue and final thoughts. In conclusion, there are various interventions that can support fertility, including L-carnitine, exercise, getting enough sleep, and limiting stress. These interventions work by optimizing egg and sperm health, which can be used as a proxy for optimizing overall body and brain health. The topics of hormones, reproductive function, and biology, such as menopause, andropause, and PCOS, will be covered in future episodes. Okay, there you have it, folks. And if you got confused by the terminology and non-stop rant of the AI voice of the British lad, please check the description and comments section for a full page of all key takeaways. Nobody does it like my AI brain, and you will learn way faster if you follow our channel. Salute.